talk about one particular piece of news which was reported over the weekend, or on Sunday to be precise. India has reported its first suspected case of monkeypox after a young male returned from a country currently experiencing Mpox transmission. The suspected individual has been isolated in a designated hospital and is in stable condition as of now. The Health Ministry has confirmed that samples from the individual is being tested for Mpox and is being treated and contained in line with established protocols. To talk more about what the impact could be on labs in case they need to test, we have with us Dr. Nilesh Shah, who's the president of Metropolis Healthcare, joining in for a quick chat. Dr. Shah, hi, welcome to the show. If you could just start by telling us that are private labs ready to test for monkeypox, and have you all tested as yet, considering that it's been around for the past 2 to 3 odd years, but we're just talking about a more virulent form of it?
So the labs, not all labs, but few labs for sure, they are ready for it. So there are two techniques for doing tests for monkeypox. One is serological test and another is molecular test. And molecular is the one which is the need of the hour and it's most reliable. And for molecular test, the kits are out and kit is available. We have already validated and kept it. Not on live sample, because live sample as of now, as per a rule of the government, as of now today, private labs are not permitted to do the test. But on back-end side, the technology, the knowledge part, the technical training, validations, everything is complete and we are ready. We are awaiting government's go ahead to run the test.
Okay.
Right. And for the citizens, just wanted to know what price are these tests priced at, and typically are you getting any inquiries for monkeypox tests?
Yes, there are few inquiries on monkeypox tests, not in large number, but few are for sure there. As far as price is concerned, it is yet to be arrived because there is no commercial decision as of now from even vendors at what price they will sell and all that. The price overall is a game of volumes also. We have seen during COVID time that as volume goes up, price goes down. It started at 4,500 and then it landed down to few hundreds. Here also similar, if at all the disease affects our country, and if testing starts and if volume goes up, the price will surely go down. I'm not expecting too exorbitant price anyway. Okay. Because the setup and everything is ready, and during COVID time, a lot of labs have adopted this setup. So it will not be scenario like what happened in COVID, that there are very few labs who had got trained manpower and the technology available. Here now, a good number of labs have adopted molecular tests, so it should not be that bad.
Okay. So when you say a good number of labs, a lot of labs also shut down post COVID-19 because there were no samples left. So in terms of molecular labs, how many do you think are available right now on the private side?
See, this will be my rough guess. I remember during COVID time, almost 4,000 odd labs, leaving government labs aside, private, I'm saying they started doing COVID tests, maybe more than 4,000. With high capacity, I'm talking about small capacity, could be a little bit more. But yes, as you rightly said, post-COVID, these labs could not sustain the setup because it requires that level of volumes and that variety of manpower sustainability and so on. And many of them shut down. But still, I believe that at least 400-500 labs still are doing molecular tests, and which is not bad to begin with.
Right. Okay. Dr. Shah, we shouldn't scare people around here, etc. But because it has happened in such quick succession to another pandemic that happens, the human mind wonders whether, is this one similar to that one? If you could give us a sense of what your, understanding of monkeypox so far is and the amount to which it can spread.
I think I would say one should not be scared. Being cautious is very important question on health, but getting paranoid and getting cautious and drawing parallel with COVID is not appropriate, I feel. It is not that bad.
Okay. All right. Dr. Shah, just wanted to ask you about the protocol as well. because during COVID-19, what we did see is that even say whenever the private labs do start testing, if in case that is also the requirement, how similar or different will it be as compared to COVID-19 testing? Because the technicians had to wear PPP kits, they had to be completely masked up. There was a lot of, you had to be extremely careful in terms of the sample. Mpox is quite virulent as well. What are the different types of protocols that one will probably need to undertake as a private lab when there is any kind of collection of samples, if there is, from the private side?
So, see, the labs will be more engaged in sample collection, and there is only contact point with patient, and we must know first what are the 3 areas from where the infection can occur. So one is direct contact. Second is respiratory droplets, which may come out from the patient. So don't go too close to the patient without mask. And third is contaminated material from the patient. These are the 3 things to be protected. Now, hence, the guideline today are to wear PPE kit. But in COVID time also, it started with full-fledged PPE kit, and also it's not that severe, but PPE right now is recommended while doing the collection of sample. Sample collection will be lesion where the patient is having blisters and so on. The lesion skin scraping, we have to take it, and this has to be brought in viral transport media in a septic condition in a properly designed boxes and bring it in a cold chain to main lab. This is what is going to be a protocol. So care definitely has to be taken. There is no escape over there. However, in COVID time, we had a lot of confusion about how the disease is getting transmitted. In monkeypox, that confusion is not there. These are the only 3 places. These are the 3 areas where one has to take care and manage the sample. And I'm sure the labs are well prepared, because we are used to doing it for many other things as well.
Okay, all right, Dr. Shah. Well, I hope we don't have to have these conversations either. But thank you very much for joining in and speaking with us and talking to us about the possibility of private labs testing for monkeypox, if in case that does come about. We'll take a short break, but up next we'll be talking to Varun Gupta, who's the Director of Ashiana Housing, to discuss their business. Stay tuned.